ABG analysis for the NCLEX, a step-by-step guide. Analyzing arterial blood gases, ABGs, is a critical skill for nurses, and it's a crucial component of the NCLEX exam. In this guide, we'll walk you through a step-by-step approach to analyzing ABGs, helping you to identify acid-base imbalances and diagnose underlying conditions. In Step 1, identify the pH. The normal range is 7.35 to 7.45. Acidic is when pH less than 7.35. Alkalotic is when pH greater than 7.45. In Step 2, you need to determine the primary disorder. If it is respiratory, it is indicated by PaCO2 abnormality. And if it is metabolic, the is HCO3 abnormality. In Step 3, you need to analyze the PaCO2. Normal range is 35 to 45 millimeters of mercury. If it is elevated, that is PaCO2 greater than 45 millimeters of mercury, it indicates respiratory acidosis. And if decreased, that is PaCO2 less than 35 millimeters of mercury, it indicates respiratory alkalosis. In Step 4, you need to analyze the HCO3. The normal range, 22 to 28 milliequivalents/L. If it is elevated, that is HCO3 greater than 28 milliequivalents/L, then it is metabolic alkalosis. If it is decreased, that is HCO3 less than 22 milliequivalents/L, then it indicates metabolic acidosis. In Step 5, you need to evaluate the base excess. The normal range, -2 to +2 milliequivalents/L. If it is positive, that is base excess +2 milliequivalents/L, then that indicates metabolic alkalosis. And if negative, that is base excess -2 milliequivalents/L, then it indicates metabolic acidosis. In Step 6, you need to identify compensatory mechanisms. In respiratory compensation, there are changes in PaCO2 to compensate for metabolic imbalances. And in metabolic compensation, there are changes in HCO3 to compensate for respiratory imbalances. In Step 7, you need to diagnose the underlying condition. A. Respiratory acidosis can be caused by COPD, respiratory failure, or pneumonia. B. Respiratory alkalosis can be caused by hyperventilation, anxiety, or fever. C. Metabolic acidosis can be caused by diabetic ketoacidosis, lactic acidosis, or renal failure. D. Metabolic alkalosis can be caused by excessive vomiting, diuretic use, or Cushing's syndrome. By following these steps, you'll be able to analyze ABGs with confidence and diagnose underlying conditions. Remember to practice so that you become proficient in ABG analysis. For more NCLEX exam guides, like the video, comment, and subscribe. Thank you for watching and listening.